My name is Kaylee Hinkle, and I will be presenting my chosen hallucinogen, Salvia Divinorum. Salvia Divinorum is known for being used initially as a healing drug for the Maztec Indians in Mexico. Salvia Divinorum is part of the mint family and was traditionally only consumed as a tea or chewed on. The Maztecs believed that this drug could provide divination, physical and spiritual healing, as well as assist with gastrointestinal problems, as well as headaches. This drug is most known as simply salvia, but has other names such as Sally D, magic mint, and many more. For this drug's effects, Salvia Divinorum consists of both psychological and subconscious effects, as well as physically presenting effects. Some subconscious effects can include feelings of dysphoria, uncontrollable laughter, overlapping realities, and distorted perception of time, and so on and so forth. Some physical effects that can be witnessed include incoordination, dizziness, and sensations of being pulled or pushed from many more directions. I do have videos for both of these effects that you're able to watch in your free time that can dictate to an extent what someone who is influenced by salvia sees and how they may look or act on this drug. Another thing to note when taking this drug's effects into consideration is that this drug is extremely unique in comparison to other hallucinogens. This drug gives many sensations that many other drugs do not. A direct quote from an 18-year-old female described her experience with salvia as time and space are distorted, the surrounding environment disappears to welcome what I like to call the salvia world. It can be briefly described as a very unreal dream. This is very accurately describing some of the subconscious symptoms we had previously mentioned. We also have to keep in mind the effects of this drug, like salvia, can be influenced by other things. In the same article by Hutton, Cavell, and Boyle in 2016, had the discussion of set, setting, pleasure, and not pleasure. Set would refer to how an individual feels before consuming any drug. Setting refers to the established beliefs surrounding the drug and where exactly the individual is consuming the drug. Pleasure is if they enjoyed the experience of said drug, and not pleasure would be if they did not enjoy the experience, usually leading to an end of usage. The pharmacodynamics of this drug, Salvia Divinorum, consists of one main compound that is responsible for giving the consumers the hallucinogenic effect. This would be salvinorin A, or we'll just call it SA for short. According to Brito, Diaz, Gomes, and Dennis in a 2021 article, SA is a non-nitrogenous diterpenoid with a very high affinity that is extremely strong and selective in the kappa opioid receptor. This means that SA is an extremely powerful natural chemical that consists of such precision to initiate these intense effects without having to use other chemicals like most other hallucinogens. According to these same authors, SA can be labeled as unique for two reasons. One being that SA is the only known non-alkaloidal hallucinogen, and two being that SA is the first naturally occurring non-nitrogenous compound. There is evidence to show that SA would be a kappa opioid receptor agonist. This would be because SA has been found to be more effective when compared to KOP agonists. There have also been studies done to show that core agonists do not induce analgesic effects in humans. A study in 1994 by Cyber confirmed that SA was found to be the active principle of Salvia Divinorum. SA has also a completely different pathway to the brain in comparison to other hallucinogens who use the 5-HT2A receptor like LSD. Instead, core is seen in the VTA, NAC, as well as the prefrontal cortex. For pharmacokinetics, salvia can be administered from what I have found in 4 different ways: inhalation, oral, intranasal, or intravenous. For inhalation, SA would be absorbed through the respiratory tract and very quickly. Since SA has a high facility, it can be moved across the blood-brain barrier very quickly. Inhalation in users has also been found to be more effective, easier to administer, as well as give the user a quick onset. Users are able to feel the effect as fast as 30 seconds after consuming SA. These effects only last around 10 minutes and peak as fast as 5. Oral admin. Salvia is absorbed through the oral mucosa. This route of admin does give users a very low bioavailability. Oral administration consists of chewing the salvia leaves in the mouth. Masticated leaves usually give effects around the 10-minute mark, but the effects are not as strong and only last about 5 minutes. It is said in an article by Hutton, Cavell, and Boyle in 2016 that immediately swallowing the leaves will not give any. This route does not involve snorting anything powdered or crystallized. This admin instead is inhaling the vapor from the salvia leaves directly through the nose. This administration of salvia would be absorbed through the nasal mucosa, but also have slower effects. Effects for this method would occur around the 10 to 15-minute mark and last for about an hour. I could not find any information on how strong these effects are, but I would assume not as strong as the respiratory tract admin. For intravenous admin, this route of admin, from what I read, was predominantly done on monkeys in the study. According to Brito, Diaz, Gomes, and Dennis, biodistribution was found to be extremely fast in monkeys when administered intravenously. There were also some individual differences found between male and female monkeys. Females were found to have slower distribution of this drug, while males had faster distribution. The researchers were able to assess this by testing the monkey's urine. These are some of the paraphernalia for inhalation, and same thing for oral. For metabolism, SA is able to be metabolized extremely quickly by ester hydrolysis into the form of phenorian B. This can lead us to assume that SA is part of the CYP450 family. This would explain SA's short action time as well. For excretion, SA has a very short half-life when taking action. According to the Brito, Diaz, Gomes, and Dennis article, when SA or Salvia Divinorum was administered intravenously, elimination of half took roughly 56 minutes. This was demonstrated in a study on male and female monkeys. In this study, it was found that there were significant individual differences found between the two. Males were found to have a shorter half-life of 38 minutes, while females were found to have a significantly longer half-life. It has also been mentioned that SA has extremely fast elimination in comparison to the other hallucinogenic drugs, which is consistent with Salvia Divinorum's short effects. In an article by Brito, Diaz, Gomes, and Dennis, looking at the half-life of SA, urine samples only consisted about 0.8% of SA when tested about an hour and a half after they had been consumed. SA was tested in consumer sweats and was not able to be found either. For the half-life of the inhalation administration, it was found to be around 50 minutes. SA was found to be more effective in comparison to COPE agonists and suggests that a different binding mechanism takes place, specifically to the plasma proteins. For physical dependence and abuse potential, usage and abuse potential has been reported to be lower in comparison to other recreational drugs. This can be due to the aversive effects. This can also be led to individuals not feeling any compulsive or persistent need to use this drug enough to develop any abuse potential. For dependence and tolerance, these extremely intense effects of Salvia Divinorum have led many consumers of this drug to stop use just after the first time. Factors that can affect this are setting, pleasure, and not pleasure. In the study by Hutton, Cavell, and Boyle, 24% of participants described their experience as unpleasant with anxiety and paranoia, while 42% of participants described their experience as pleasurable, explaining that these scary hallucinations were described as unpleasurable for some were found pleasurable for this group. In withdrawal, Salvia Divinorum can look like intense anxiety, irritability, and feeling of uneasiness, as well as nausea and vomiting. Symptoms of withdrawal have been reported to occur after the stopping of chronic use over time.